All right, welcome everybody. So excited. My name is Dan Harrah. I lead clinical partnerships here at Spring Health, and really excited about this webinar today to talk through 5 mental health hot takes. There's a lot going on, and this is one of the more serious environments that we've ever been in as we talk about mental health going into the year 2026. Right now, about 65% of your employees are saying that they're in worse shape mentally than they were 5 years ago. And those of us who remember 5 years ago, we were not in good shape mentally at that point. 52% of US adults with a mental illness right now are not actually receiving any treatment. And employee engagement is down about 21% globally across the globe. The other important thing I think to note is we're in this age of AI, and about half of US adults are actually utilizing LLMs for mental health support. Just to give you a spoiler alert, that is not something I would recommend at this point in the evolution of mental health support through AI, and we want to be really safe and ethical. So those stats are pretty alarming, and they paint a really clear picture at this point. Stress is up and uncertainty is really up at this point. So what do we think are going to be the major hot takes for 2026, and what should you be doing about it, I guess is the big question. So before we really dive into these topics, I would love to just lay a little bit of ground rules for this conversation. A couple of reminders. The session's being recorded, and you will get a copy of the recording at the end of the session. There's also a Q&A feature that you can see. It's enter your message to the right of the screen there. Please, throughout the conversation, add questions, and at the end, we will do our best to address all of those questions. And finally, at the end of this event, you will receive a survey, and we really value that feedback so we can continue to improve these events that we put on for our customers. With me today, I am so thrilled and honored to work alongside these two exceptional leaders here at Spring Health. We have Kelsey Witmer. She actually leads our people and total reward teams at Spring Health, VP. And then Kelly Ellis, who is a senior consultant with Piper Jordan in delivery excellence. I've had the pleasure of working with both of these leaders for some time now, and I think they're going to bring wonderful insights to this conversation. So before we get started and we start diving into these hot takes, I actually want to point to you, to the audience here, and I would love for you to use the chat to share. What are you thinking about? What is one mental health issue that 2026 will be defined by? And we'll see how close how your thinking is with our thinking as we work through these 5 hot takes. So go ahead and enter in your ideas here. And while you're doing that, I'm going to ask both Kelsey first and then Kelly to introduce themselves. So Kelsey, please go ahead.
Yeah. Hi, everyone. My name is Kelsey Witmer. So happy to be here. Like Dan said, I'm the VP of Total Rewards and People Operations at Spring Health. This is a fairly new role for me. I've been in it for about 30 days now, but I actually spent my first 2 years at Spring as the head of employee experience. So I think mental health and well-being in the workplace is actually like a perfect marriage of employee experience and total rewards. So I'm really looking forward to this conversation today. Pass over to Kelly.
Thanks, Kelsey. Hi, everyone. I'm Kelly Ellis. I am the Senior Principal of Delivery Excellence at Piper Jordan. My work at Piper Jordan sits right at the intersection between benefit strategy and cost containment and employee experience. So I get a front row seat to what employers are wrestling with, and more importantly, what's actually working. So I'm really excited to dig into these trends with you today.
Thanks so much, Kelly and Kelsey. Getting some wonderful engagement with the chat right now, seeing a few different things. Self-diagnosis or utilizing TikTok and some of those resources for self-diagnosis. Adolescent mental health, something I certainly talk with customers about very often. How to address change fatigue is a comment that I see here from Sarah. So thank you, Sarah, for that. And just a lot of comments about conflict and polarization in the workforce as well. So we're going to touch on several of these during the conversation. I really appreciate the participation, the active participation of the audience so far. And with that, I'm actually going to dive into our first hot take, and it's related to cost, of course. Cutting cost is number one, but a new playbook must be used is our first hot take for this conversation. I have this conversation with customers, existing customers, with prospects all the time, talking about medical trend, talking about proving value and demonstrating value over time with their vendor strategy with their overall healthcare and benefit strategy and their overall people strategy. And I want to actually point this first question to Kelly. Kelly, in your role, what are you seeing?
I think employers are approaching 2026 with more intentionality and less tolerance for unmeasured benefits. The two things I hear the most are predictability and value. They want fewer surprises and clearer outcomes. And clients don't feel like mental health is optional anymore. It's a risk management lever. And we're seeing that shift towards those more holistic strategies. Mental health, leave, disability, pharmacy, they're all really viewed together at this point in time.
Yeah, for sure. And what I'm seeing in my conversations is that sort of proof of quality is a big question that they've got. I think historically in mental health, and I've been in this game for a while now, there was sort of this idea that mental health treatment was sort of this black box that somebody goes into treatment with a therapist, something magical happens in there, and maybe they get better, or maybe they don't. And increasingly, customers are asking for proof points. Does the mental health treatment work? And how do you even know if mental health treatment works, right? Are people getting better? Is there a claims experience difference, right? When somebody gets good mental health treatment? And increasingly, what I'm hearing from our customers is what you're delivering at Spring actually gives us answers to those two questions. Is the treatment any good? And what is the cost impact of it? And increasingly, they're saying, maybe we should look at a plan design that actually emphasizes going to centers or to providers where there is proven quality over time. And one of the things that I heard you talk about, Kelly, as you were kind of going through what you're seeing in your conversations with employers, actually brings me to our second hot take, which is really where cost and humans sort of really interact right now, and that is leave and mental health leave of absence. So to move to that, we are seeing that leave continues to rise, and there's a real need to modernize here. Kelsey, I want to flip this one to you. As a people leader, how are you thinking about leave of absence right now?
Yeah, if you just caught that, my eyes like twitching a little bit. 30 days into the role, and leaves of absences are probably the top thing that are keeping me up at night right now. What we know is that many employers are seeing significant increases in mental health related leave and accommodation requests. A few of you have made a comment on it in the comment box here and are probably struggling with this in your own organizations. And then generally, organizations are running leaner, expectations are higher. Employees are also more informed about their options and what's available to them. And they're setting firmer boundaries, right? So when work isn't sustainable, when they're reaching that point of burnout, they are more willing to take a step back from work than what we've seen in the past. This puts companies and specifically HR teams in a tough position because we need to have programs that are robust enough to truly support employees in crisis, but also effective enough to help people get better and return to work. And sometimes that getting better and returning to work can feel not empathetic, right? But it's not just about coming back to work. It is about giving employees more than just time off and giving them real outlets for recovery. So, yeah, go ahead, Dan.
I was just thinking when we were sort of planning for this conversation, as we were talking about this, it's such a rich topic. We said, man, we could probably do the entire hour just on leave and the strategies around leave. But I think you nailed it, that aligning toward what is leave really about? It's about getting better so that you can be your best self at work, not just a break from work. And so that brings up a couple questions to me when I think about it clinically. How do we prevent people from raising their hand and saying, I'm so burnt out that I need to go on leave? What can we do from a structure standpoint? What can we do from a leadership and psychological safety standpoint to prevent those leaves? Yeah. But then when somebody does go out on leave, are we really cleanly linking the reason for their leave to a mental health condition? And then if we are, how are we providing treatment while they're on leave for that mental health condition so that we can treat them and they're better and ready to come back to work? So in the program design that we work at Spring Health, we want to address both of those things, right? We want to address not only the preventative part and the psychological safety and culture part, But also when somebody does finally get to that breaking point, can we get them fast access to a really good provider for them, in that moment? There and then is a big question. And it's something that we've really designed as part of our program. And I could go way, way deeper on this. Kelly, I think I saw you at just a moment there, having a comment in there, and I would love your perspective on leave as well.
Yeah, for sure. And I think that I see really generous leave policies from a lot of employers, but what we're not seeing as much and where we're seeing a focus shift is that stay at work support, right? How do we get employees to stay at work? What can we do while they're on the job to support them before they go on a leave? And we're also seeing those repeat leaves are one of the biggest silent cost drivers.
Mhm.
They're usually a sign that the return to work was reactive, right? It wasn't clinical. And so it's really important that we really kind of shift that focus. Is once people are out on leave, it's obviously harder to get them back. How do we prevent them from going? What can we put in place as consultants and employers and leaders in the space to ensure that employees stay at work and feel that they have those resources available to them?
I just want to triple underline this point. I think the best thing that we can do in this space is preventative work. Like the clinical work that happens while people are on leave, I think is so heavily impactful. But and how can we create opportunities for healing and recovery and rest before somebody gets to a point and says, I cannot be at work anymore. I am not capable of logging in and sending this email or doing the job that I am being paid to do because I am in such a moment of distress. And I think that's where the real work comes in. Okay, with that said, I'm going to move us on to our third hot take. So we've talked about cost and leave. The next major driver of anxiety heading into 2026 is AI and what it means for people's jobs and well-being. So I know that AI came up a lot in the comments that we saw to Dan's question. So we know that AI is not just changing workflows, but it's changing how people feel in their careers. So if we go to that next slide, Dan, I'll talk a little bit about this. So we know that recent surveys show that a large majority of adults worry about the broader economic effects of AI, and nearly half worry about what this means for their own jobs and their own job security. In addition to what is this going to do for me in my job, there's also this uncertainty is showing up as emotional fatigue. So it's people feeling like they're up against a really strong, steep learning curve that they probably haven't felt, especially for those of us that are a little bit more tenured in our career, right? We're learning new technology. We're doing it at a rate that is unprecedented. And I don't know about you, Dan and Kelly, but there are times when I lean into AI and I'm like, wow, I don't remember the last time I didn't know how to do something so much. And that creates pressure, right? Whether you think that that's going to impact your job ultimately, or it just kind of makes you feel like you're not able to keep up with technology, it's not a good feeling and it's creating anxiety. Additionally, there are some employees and people out there who have not been impacted by AI yet, but it's so present and around us that they're like proactively bracing for impact, which is almost harder because there's a lot of ambiguity and not real expectations yet. Yeah, go ahead, Dan.
I think of it so I'm a licensed clinician by background and, have worked with a variety of mental health conditions and people with those presentations. And what I hear when I talk to folks, like the most common and most prevalent mental health presentations in globally are depression and anxiety. And so, depression is low mood, feeling down. Anxiety is really characterized by worry. And the number one driver of anxiety is uncertainty. Right. And so, like, as you can probably imagine with AI, there's the component of it of, am I going to still have a job? What is that going to mean for me? And then how is it changing my job if I even do still have a job? That's going to just generate a ton of anxiety with employees, whether they're leaders, whether they're entry level. They're going to be worried about this. They're going to be worried about what does the future look like, not just at their work, but where is AI kind of taking them? And when I think about what good looks like, and some of what you were talking about previously, Kelsey, is culture and safety and creating space for this. What I think about what good looks like is providing as much clarity and transparency as you can, for folks. Here's how we're going to use AI. I think it's some of the work that we do at Spring Health in terms of educating our leaders, in terms of educating our employees on the different tools and resources, how to use them, and providing those options, and then really pointing to AI not as something to replace you, but something to supercharge and superpower you in your role, right?
Yeah.
And so taking that sort of top-down leadership, we're going to talk about this thing that's out there. We're going to talk about what those plans are, is a real great way to lower that anxiety. Because if you don't state it explicitly, what people will do, because we're all humans, is we will fill in the blanks with our brain. And that may or may not be accurate to what's actually going to happen. And that can really drive up anxiety.
Yeah. Yeah.
One other thing on this topic, if I can jump in really quick, is that I think from a therapy perspective, the biggest question I get, how are companies like Spring leveraging AI? Does it replace the human element? And I think that's the biggest question we get is employers want to make sure that it is a guidance, or like you said, a complement to care, not a replacement of care. And so kind of shifting that focus from the anxiety, but to what we're seeing on the consulting side, it's where does AI fit into the care continuum, right? How does it complement what you're doing at Spring, and making sure that it's for clinical notes? And that's one of the reasons why we partner with Spring, is knowing how strongly you feel about that clinician-based care, and using AI to complement is really critical to the conversations that we're having. And honestly, one of the first questions we get when people are putting in a behavioral health or EAP tool.
I love that you brought that up, Kelly, because I do want to talk a little bit about what good looks like in terms of AI and incorporating AI into clinical care. And this is something at Spring. We have a group called the Health Economics and Outcome Research Team, and they are 7 PhDs. So these are folks who are experts in mental health and experts in AI, and they are truly on the forefront of this research, especially around the number one concern with AI and moving AI into mental health care, of course, is safety, as it should be, right? Is an AI bot going to give advice that could put somebody at risk or somebody's family member at risk? So at Spring, we've actually worked to develop the first open source. So open source is really important. We didn't call it proprietary and hold it to ourselves, but the first open source evaluation criteria for AI tools in mental health. And so we're looking at things like GPT-5 and Claude and all of these different tools that are out there. And we're looking at the safety layers that they have. We're looking at the clarification layers, because as a licensed clinician, people often, and just to let the folks in the chat know, I'm going to talk a little bit about mental health risk, which does involve suicidal thoughts and suicide sometimes. So just, if for fair warning. But when somebody is at that level of extreme risk in mental health, they often don't just directly say, I'm suicidal. I'm thinking of ending my life. They may make more vague statements, right? Or they may make even provocative statements, but actually do not have any actual harm or intent of harm to themselves. And so a really good clinician is quite good at picking up the nuance in what's being communicated and what's not being communicated, and then guiding that individual to the safest outcome possible. Can AI do that really well? Well, our early research is actually showing that AI is better at picking up safety risks than the average human clinician. And what we're going to find as we continue to do this research, and what we can commit to you, is that we're going to do this research in an open way, is as we have these learnings, we're going to use the AI to actually make clinicians better, to actually help those clinicians be better. And one of the first things that I asked when we said, hey, we're going to have this AI strategy, is do we have humans who are going to be monitoring what's happening, here in the AI? Do we have the AI actually diagnosing people or providing treatment? The answer to the first question, of course, we have humans who monitor everything. The answer to the second question is absolutely not. The AI is not diagnosing or treating mental health conditions, right? So these are like really important considerations as we think about the ethical use of AI. The third really important consideration with AI use in mental health is transparency. Make it super clear if and when you're interacting with an AI chatbot or not, and allow people to opt in or opt out. So the AI tools that we built into our platform are really, really great at helping to summarize the content of a clinical session between a human being and a human being. They're really, really great at pulling out like important next steps for those clinicians. But we aren't asking the AI to actually do the treatment. And a member or a clinician can always say, you know what, I don't want to do this. And they can still have access to Spring Health. So giving that ability to opt out is super important from our perspective as well when it comes to AI.
I want to synthesize. We just spent a lot of time talking about a few different topics on AI. So let's synthesize a little bit here. We know that AI is driving a lot of uncertainty, fear, ambiguity, worry in the workplace. We also know that AI in general in society is being used and accessed as a tool for mental health care. So I think if you wrap up what we just said is that one, employers to their employees have a responsibility to be clear with expectations and providing the right level of support and resources for AI to be a tool that employees can embrace. In fact, I actually think that when leveraged the right way, AI can help reduce burnout because it's offsetting cognitive load, right? We also have a responsibility to make sure that our employees are not using an LLM, right, like ChatGPT for mental health support. And I want to like bring this to life by what we do internally for our employees at Spring. So we had a really big push this year on getting more people using AI and comfortable with AI to create efficiencies, reduce cognitive burden and load. We had a campaign called the Summer of AI where we did like really basic 101 training offered to everybody. People didn't have to self-select in. You didn't have to publicly say, hey, I don't know what I'm doing. Like, how do I get the support and resources I need, right? And we're going to continue that journey. We also know when our employees come to us, whether it's in distress or we're seeing early warning signs, we are obviously not directing them to ChatGPT, right? We are directing them to Spring Health or like the internal product that we use, that we offer to our customers. And that is the tool, and a clinically validated tool and clinically trained and licensed therapists are who we are offering to our employees when they're in those moments of distress. Dan, did I miss anything from the synthesis?
No, but I'm just so appreciative of the synthesis. It's such a meaty topic that has multiple components to it, for sure.
Right. That's right. So I do actually think this is a great segue into our next hot take. So we know that if AI is reshaping how people feel at work, then our next hot take is actually about how care itself is changing to match an always-on world. So I think we saw this come in through the chat to your first question, Dan. People certainly talking about AI. I think somebody mentioned TikTok, right? We are in a world where everything is accessible at almost all times. And so our hot take here is that in 2026, employees will expect mental health support that is continuous, right? It's not limited to a single session a week. It's not episodic. We know that nearly half of US adults we just said this, right? They use LLMs, they use AI for psychological support in the last year. And as Dan just said, not all AI tools out there are clinically validated and safe to use for these purposes. So despite like very well publicized risks of off-label AI for mental health, this does not slow the expectation people have for mental health support within reach in real time. So Dan, I'm going to turn this back to you and ask you to talk to us about the clinical side here.
Yeah, I think there's a couple things to hit on here. One is, how do clinicians sort of adapt from a stodgy research-based world where sessions are held once a week for 1 hour, and then really the expectation is that the clinician and the member don't really communicate at all in between the sessions, right? It's the session occurs, come back a week or two later, try to remember what happened in that session a week or two ago and kind of keep things moving. And that's a relic of just older ways of doing things, right? And we know that those older ways of doing things are not consumer grade, and they don't sort of meet the expectation of the average consumer of mental health. So the average consumer of mental health is wanting to know not just that I have access to a therapist, every other Tuesday, but that I have access to the right support for me, exactly the right support for me. And so this doesn't mean constantly being in contact with your therapist every time that you have any level of distress in your life. Actually, clinically, that is very contraindicated. You would not want to set somebody up that anytime that you have distress, you reach out to somebody and they immediately respond to you. That's actually kind of reinforcing of problematic lack of self-soothing skills and things like that we all can work on, right? However, we can really amplify the power of a clinical intervention in a session if we are looking at what happened in that session and what are the types of homework or the types of work that you can do in between sessions to make those sessions more effective. And AI and those types of systems can be really, really effective in doing that. And we're starting to do some research on this that shows that when we can give people the right exact care for them and the right exact intercession activities to do, we actually get better outcomes faster. So you get people better faster in terms of their self-reported symptoms and their symptoms improving. So for the sake of being a clinical nerd here, I'm going to talk about an idea of measurement-based care. And that's the idea that really good clinical care starts with a diagnosis, and it starts with understanding the level of severity of that diagnosis. And so you do that with the thing called a validated clinical screener. And you look at where somebody starts, that's called their baseline. And then as they're in treatment, you look at whether or not they're improving on those numbers. Are they reporting fewer symptoms over time? That is the gold standard for what really good clinical care looks like. And what we can actually do is we can look at two people who have exactly the same score on a depression screening. Maybe person A is moderately to severely depressed. They have a 21 on the PHQ-9. Person B, same, 21 on a PHQ-9. What AI can help us do is understand more about their life context, not just that the level of symptoms that they're having on those validated clinical screeners are the same, but maybe person A just moved into a management role at their job and is stressed out about that. And person B just had a baby and is stressed out about that. What if we can use AI to gather that context and then tailor the interventions and treatment plan and the types of resources that we would give to the person based on their specific life context to make it more applicable, to make it more useful to that individual? Very similar to how when I go on Netflix, I have a list of shows mostly about baking and barbecue. And when Kelsey goes on Netflix, she has a list of shows mostly about I'm not sure because I haven't seen Kelsey's
It's psychological thrillers, Dan. That's what's on my Netflix.
There you go. And so it's like whatever my individual need is, the consumer grade expectation right now is that I can get it immediately and that it's for me. So can we do that in mental health and not be so stodgy about, hey, we have our Tuesday afternoon meeting and I'll see you again next Tuesday. But what can we do to actually amplify this? And Kelly, I know I've been talking a lot. I know as we chatted in preparation for this, you had a couple thoughts on this as well. So I would love to kind of kick it to you as well.
Yeah, and I think what we're seeing is exactly what you're saying, right? We live in an on-demand society, right? Everyone wants care right now at their fingertips. And on the employer side, employers are asking different questions now, right? As you said, Dan, what's happening in between the sessions? Are we meeting our employees at their moment of need? And then are people actually improving, right? You mentioned that, not just attending, are they improving? Employees want mental health care that's immediate, guided, seamless. We want clinically sound results. And so employers want the assurance that the technology behind the convenience of care is validated, safe, and more importantly, in the world of rising cost, outcomes driven, right? Yeah. How do we ensure that the shift isn't about more care? It's about better timed care and delivering when someone needs it. And that's where you're starting to see that prevention, stabilization, and ultimately cost savings as a result of it.
Yeah, I mean, broke it down the simplest way when I talk to customers is I say we get people better faster. And then they ask me, how do we do that? I say, well, we can prove it because we're a measurement-based care company. And then it goes into this whole conversation of exactly what you're talking about, Kelly. How do you ensure that you're getting people to the right effective care for them versus just a peanut butter approach of spread care over everybody go to therapy? Well, that's not the right answer. Nobody go to therapy. Well, that's not the right answer either, so it's get people to the right type of care for them. And AI is going to be a massive, massive amplifier of our ability to do this even better than we're doing right now.
Yeah. Dan, I want to add something here too. From the employer side, as somebody who sits in the role that is often going to market for benefits like these, what's really important, what employees expect is always on or continuous intervention, right? So that means that for HR teams and those of you who are in roles like this, we look for the tool that can meet the need. And that means the tool and the partner that we work with has to have a variety of offerings, right? Therapy, coaching, digital self-service tools, AI embedded. And that's what we're looking for because it's not a one size fits all approach. We want to know that, the therapists and the coaches we're working with aren't afraid to get fired, right? They aren't afraid to say, you're graduating from care, you have reached your goal. And it's not just an every week for the next 3 years, you're going to be discussing the same things and talking to the same therapist. And so I think the real beauty here is where AI and technology come together with the human touch and create this environment and ecosystem that is so personalized to each employee who is in need. And that's really what we're looking for on the employer side.
Yeah, I mean, going back to the beginning of this conversation, I said half of US adults who have a mental health condition do not receive the care that they need. And as you could probably imagine, if a therapist looked at their caseload and looked at all of the members that they're serving and looked at them as a commodity that they needed to keep in care forever in order to keep getting paid, that's going to exacerbate that problem of access. But to what you're speaking about, Kelsey, that actually getting people better and graduating people from care, basically when people will report to you, I'm better now, that actually increases the access and helps us to solve this global issue of that. I want to shift gears a little bit to our last hot take. As you can tell, I get super excited about this piece, but this last hot take was actually one when Hayden and our events team asked me to participate in this. They asked me for my hot take, and this one was actually mine. So I have a special affinity for this conversation. I think it'll continue to be a rich conversation. So hot take number 5, you can't control social issues, but you can control your plan. So when I think about this one, I kind of like these stats that are on this next slide here. The reason that I like these stats is because it does not indicate which side of the aisle these employees are on, but 64%, so nearly 2/3 of US workers are saying that they have witnessed or experienced negative treatment in their workplace due to their political views. And just to add a little bit of color to that, when I talk to people on my team, they'll say things like, Spring should take a very loud and principled stand on XYZ issue, a political issue, right? They need to put a stake in the ground and say this. And then I talk to other employees on my team and they say, Spring needs to stay out of this. This is not our role. Is one of them better or more important than the other? It probably depends on your personal viewpoint. But this 64% represents people on all sides of this and are saying, I'm getting this level of mistreatment, harassment, feeling bad about this. And they're saying they're distracted by it. And we have a election year right now, right, in the United States, right? We're going into midterm elections. There's going to be a lot of political ads, a lot of political divisiveness. There's quite a bit of both in the US and globally, very, very divisive issues going on. So Kelsey, I wanted to flip it to you again as a people team leader, and this is probably your favorite part of your job, I assume.
Yeah, Dan, when we talked about leaves, my right eye twitched, and now when we talk about political divisiveness and the social economic landscape for employees, my left eye is twitching. This, I think, is so important. We've seen it this year, I think, more so than we've seen in past years, which is a lot considering, everything that we've gone through in the last 5 years. But yeah, I mean, the theme here is that employees have higher expectations of their employers than they ever have before. We hear so many employees saying that they want companies to take a stand. And if they don't take a stand, then they're not allies of the community, right? That's impacted by whatever's going on. At the same time, people teams, leadership teams, companies, right? We know that we have to be so careful about what we say. And it's not just because like anybody can post anything on LinkedIn or a reporter can pick anything up, right? It's because we cannot risk marginalizing one group at the company to make another more majority group feel good. So how do we do this, right? It's our responsibility to create safe spaces for our employees. And on one hand, if we aren't saying anything, then one group doesn't feel safe. If we do say something, another group doesn't feel safe. There are a few things that we do at Spring to kind of mitigate this, right? We create the right spaces at the right time. We have a wide variety of ERG-led discussions that are safe places for people to self-select and to have the freedom to speak about what they want to speak about without it necessarily being like blasted all over Slack and making people feel uncomfortable or marginalized. We also have at Spring, we have a rapid response model that our communications team uses to decide how we will respond to what is happening in the world. And there are very clear things that we say, this is what we're going to take a stance on because of how it aligns with our company mission and values. And this is what we won't, because it's not really our place. And being proactive about that and sharing that with employees, not when just somebody's upset that something was or wasn't said, that helps set the expectation. And then the last thing I'll say here is, and Dan, you probably remember this, right? Probably about 3 months before the last presidential election, we released a really robust toolkit to help employees navigate that time, managers navigate that time, reminding people to not assume that everybody's voting the same way you are, and creating safe places for everybody to be able to show up and ultimately normalize what's going on and come to work. So that's a little bit about what we do here at Spring, but I just think the expectations are kind of impossible to meet right now.
I totally agree. And I like what you said about we create spaces for it's voluntary, right?
Yeah.
We aren't forcing people to go to talk about these things. We're allowing the space for people. So, I'm an old guy, and I remember when I started in my career, it was like you just don't talk about any of this stuff.
Yeah.
Was sort of the mentality. And I think that's the shift that I've seen. Mm-hmm. And I think that balancing act that's a bad message too. Like, we won't talk about this at work is a really rough and tough message, and will drive employees to look elsewhere.
Yeah. It's invalidating, right? And so we have to validate. I speak about this, like, we have to create environments and experiences that people can engage in when and where they need to, but that are not forced on an entire population based on assumptions.
Yeah. Kelly, and I think what you're saying is spot on, right? That unstructured dialogue around political stresses, it can really harm culture, and structured support really prevents that. And, as on the consulting side, I don't expect employers or the vendors that I work with to pick a side, but what we can do and, guide them to is, for their employees, we want them to show that they believe in clarity, consistency, and really psychological safety, right? You want to have that really safe space at work, and defining that, and what you're doing at Spring is really truly aligned with that philosophy.
Yeah, amazing. I think we're going to have a little bit, I've seen so much activity in the Q&A, and I think we're going to have a decent amount of time to start addressing some questions here. So really lively and fun conversation. Candidly, I've really enjoyed talking about this, but I think what today's conversation has really made clear is there's a lot of high impact topics going on right now that are top of mind for businesses and HR leaders. We started with cost and value. We talked about increases in mental health leave. AI anxiety was a broad and rich conversation. this idea of consumer grade or continuous access to the exact right care for you. And then finally, political and social tension. And all of these things are likely already impacting how your business operates and how you're thinking about your strategy for 2026. But at Spring, hopefully what you heard through this conversation is we believe that the only sustainable strategy is one that is science-based, data-driven, personalized, and proactive, right? So would love to have a conversation with you at any point. This is actually up on the screen right now as a QR code if you want to demo what Spring can look like in terms of personalized and continuous mental health care. And would like to chat with us, obviously, we would really welcome that. So with that, I'm actually going to move us into our Q&A component. And remember that you can utilize the chat, and we'll start to go through there. Let me.
Dan, while you maybe monitor this chat, I'm going to toss a question to Kelly, if that's okay.
Sounds great.
Kelly, you ready for me?
I'm ready.
Okay. I just want to go back to cost containment for a minute.
Yeah.
So if we know that we can't just spend more on benefits, what's one concrete way to prove that our mental health investment is actually bending the cost curve and not just adding another line item to the budget?
Yeah, that's a great question and a tough one at that. Cost pressure, it isn't just a theme heading into 2026. It's really shaping every single benefits decision. What's changed is really the intensity of it. Employers aren't just seeing higher premiums, they're getting hit on multiple fronts, right? Stop loss renewals are climbing steeply, right? We're seeing 20% plus in the marketplace. We're seeing dramatic increases in our high cost claimants in the $1 million, $2 million, even $5 million claims are hitting. And then let's add on the pharmacy trend, right? It's low double digits for pretty much every group. And that pressure is just creating a plan design that no one can really outrun. So the conversation isn't really where we can cut, it's become where can we invest our dollars so we can change the trajectory of the spend, right? And so that mindset shift is happening. And if you squeeze the wrong part of the system, you get that short-term relief, but not that long-term cost, disability duration, turnover, medical escalations, you name it, right? So employers who win in 2026 won't necessarily be the ones that spend the least. I'm just going to call that out there. They'll be the ones that get the most value out of their dollar through steerage, right? Through transparency, measurable outcomes, right? Circling back to that ROI. How can we guarantee that people are getting that care that they need? And really the partners who can prove that. And that's kind of, like I said, that landscape is really changing, right? Cost is running away, right? It's off the rails. And I think for everyone on this call, you've seen it. And so it's what can we do now to invest in programs that give us that ROI to help us move ahead.
Thanks so much, Kelly.
Kelly.
I do see a question in the chat, and obviously encouraging any additional questions that you have. This is from Ovia. Are there any resources from Spring that help to address anxiety around environmental impact of AI with data centers directly impacting smaller communities and SDOH needs? SDOH, love that question. SDOH is the acronym for social determinants of health. That's basically talking about the environmental factors that impact our health. We know that your zip code has a more predictive indication on your health than literally anything else out there. So where you live, the environment that you're in, and the socioeconomic status of the individual has a massive impact on health. So absolutely, in terms of resources at Spring for any topic, whether it's AI and anxiety around AI, we have a whole team, a clinical training and programming team that's constantly developing content that can support employees in different group type settings or in webinar educational settings, or even giving opportunities for people to express how they're feeling about these concerns. The actual platform itself is extremely individualized as well. So if the anxiety that you're feeling, I did see a really good comment in the chat as well, that anxiety is not just worry. Absolutely, that is correct. I kind of oversimplified it earlier there. Absolutely, that is correct. But if your anxiety or worry about a particular topic is getting to the point where it's starting to impact your life. It's starting to impact an aspect of your life, like your ability to show up for others, your ability to show up for work or your family, your ability to do your day-to-day. That's when I start to, as a clinician, start to say, there may be an opportunity to get you connected to another clinician who can support you in figuring out the right strategy and the right treatment plan to bring down those symptoms so that you can be yourself again. So that is really a key resource at the individual level, but we also provide resources at the group discussion level at Spring Health. So to answer that question.
Dan, I'm going to take this next question from Emily. I think posted it a few times here, and it's really great. So Emily asks, people are using ChatGPT for both work and working through personal issues. Since AI is self-learning, do you think that anxiety and personal conversations could influence how the tool helps with work? I'm going to share my thoughts on this and what we talk about internally with employees when we're teaching them how to use AI. I will just caveat this. I'm not an AI expert, but I am a bit of a nerd about this. So when we talk about tools like ChatGPT or Gemini specifically, they're LLMs. LLM stands for large language model. Essentially, what this tool is trained to do is predict what you want to hear next based on the information you are giving it. That's oftentimes why if you're working with chat, you might need to play devil's advocate. You might need to, ask it to say the thing that I don't want to hear. So to your question, Emily, absolutely. These large language models, they use and leverage what you are telling them and the patterns they are picking up from you to inform the feedback you are getting, right? And so we at Spring, we often tell people, we have prompts and models on how to engage with an LLM in a way that's going to get you maybe a little bit more unbiased or objective information. But it is something that we should all know. LLMs are not giant computer brains that just know everything all the time, right? They are predictive language models. And the more you give it, the more it reflects back your own style. That's why if you've used ChatGPT or Gemini to refine emails, for example, that's a big thing people use it for, right? Make this email better. The more feedback you give it on what you're looking for, the more it actually learns to talk like you and sound like you. So it is something we should be really, really mindful of. And I think just quadruple underlining Dan's point that these tools are not clinically validated, right? They are not valid sources of treatment or advice. And that's also why we need to take an extremely safe approach to that and the work that we're doing at Spring.
Yeah, a really good AI tool recognizes when it's getting out of its lane when it comes to clinical, and will actually connect somebody to a live human being who can help them. Right now, we're seeing the evolution where they're pointing people to 988, which is the suicide prevention hotline here in the United States. But then they kind of just are like, I'm done, and so we would really recommend, linking people to a live human who's a licensed clinician in those instances where there is any kind of safety risk there. I see a question from Christopher in the chat. It's kind of similar to the question on AI anxiety around environmental impact of the data centers, but question around resources around helping employees avoid political burnout. Very similar answer. Absolutely. We have a variety of different clinician-led presentations and topics around political burnout, around political noise, and different strategies. I really like these topics because the way that we have designed any of our trainings here at Spring Health is with both a clinical lens and an adult learning expertise lens. So what that means is throughout COVID and everything, our attention spans have shrunken really, really a lot. And so when we develop this type of content, we want to make it really engaging. And we actually engage our audience at least once every 3 minutes in this type of content. We always ask our audience, what brought you here at the beginning? What are you hoping to learn? What's in it for me? And then at the end, we ask the audience, what is one thing you're going to take away from this conversation? So we work really hard to integrate specific skills and things that the individuals who might be coming to this training can use going forward. So give them a takeaway of something that they can use as a strategy to help deal with whatever the training topic is, like burnout. Thanks for the question, Christopher.
There's another question in the Q&A here that I actually think Kelly, Dan, and I will all have a slightly different perspective on. So that might be a fun one. I'll just read it out here. Employers have many different resources for their employees. At times, it's confusing for the employee on what they need. How do you encourage employees to reach for early intervention and use the services employers have for them? So, Dan, maybe I'll answer this from what we do at Spring, and then you can answer from like how we support customers. And then Kelly, maybe you can answer just from broadly like what you're seeing across your clients.
Sounds good.
I will say this is a big problem we have at Spring, but it's not at Spring. It's like everywhere, right? We are in a world of like transparency and information overload and like really curating specifically benefit and perk programs to meet many different needs of many different employees. And what that means is that we have this robust toolkit for people to access, but not all tools will necessarily be applicable for them. And in a time when like workload is high and burnout is high and people are taking mental health leave, like how do we get them to care and like really dive into this as a tool and support? And at Spring, we take a push and a pull method, right? We have really clear, accessible guidance for our employees. We implemented earlier this year an AI Slack bot into Slack. And so like if you can't find what you're looking for, you ask it a question and it finds it for you. That's great. But we also don't assume that employees even know to go looking for this information. And so we embed it across multiple points in the employee life cycle. Certainly in onboarding, that's almost not valuable because nobody remembers anything from onboarding because you're drinking from a fire hose, right? Anytime maybe there's something going on in the world that we are responding to, we push our mental health resources and benefits to our employees. We do regular reminders in our company newsletter, and it's not a perfect approach. It's not something. I mean, like we obviously have at our company have quite high utilization of our mental health benefits, but it's not a perfect approach, and people are overwhelmed by it. And so we have to kind of stack rank what are the most important things we offer our employees, what are the things they're going to get the most out of, and just continue to feed it to them in multiple channels because it will stick when it's time for it to stick.
I think what the other thing that really makes a benefit stick is if somebody goes and they use it, they like it and it worked, right? Yeah. So I often, when I say I used to be a benefits consultant like Kelly, I often will say when I'm evaluating vendors, I always am asking those 3 questions. Do people use it? Do they like it? And does it work? And if you answer yes to all of those things, it actually becomes a little less difficult. Like Kelsey, if you put out a benefit tomorrow that everybody gets $100 if they do a 2-minute survey, the participation in that is going to be very, very high because heck yeah, $100 for a 2-minute survey, I'm going to do that, right? And so like, if it actually has value, that what's in it for me, it's a lot easier. So if people understand what it is and they see the value of it to them, it's a lot easier. And Kelly, I would love to kind of hear your perspective because I'm sure this is a constant conversation you're having.
It is a constant conversation. And I think a lot of employees really struggle, right, to find that right solution because employers are just pushing out too many solutions, right? Where do I go? I've got 18 different apps. Each one leads me to something else. I mean, and curating that content in a way that is digestible for an employee, and especially you think about an employee in crisis or struggling, where can they get an answer quickly? And I think more is not more. They're just that abundance of programs, it doesn't automatically translate to value. And I think that's one of the things that we try to really impress upon our employer groups is don't just put it in because it's the new shiny penny on the block. Right? What is it going to do from a value perspective? And when an employee needs it, how are they going to get there? Right? Kelsey, you mentioned multi-channel, right? How do we get a communication strategy that is tight enough that we focus employees on the areas that they need to quickly? They don't have to go 18 different places to find it. It's not built into something else. And then multi-generational. Let's not forget, you've got a whole different scope of workers in the workplace, right? From the boomers to the Gen Zs, they all think differently. A different method of communication is going to work for a boomer versus my kids who are all in college. Who wants to be on the phone if you've got English as a second language? They do things very differently than a native speaker. So we really have to make sure that we're communicating our programs to those employees, that we're supporting them, not only generationally, but from a language perspective and in a way that really curates that content.
Those are such good points, Kelly. We could have spent a whole hour talking about communication strategies as well. I feel like based on these comments. I love this question from Robert Cruz. He said, for organizations using Spring Health, can you talk a little bit more about what metrics or outcomes they usually track to determine ROI? I lit up when I saw this question because there's very few organizations that have the data that we have at Spring Health to actually be able to demonstrate ROI and to have metrics across 100% of their interventions. So let me explain what I mean there. When you look at a typical health plan carrier, so that is, Aetna, United, Blue Cross, Cigna, those guys. I'm not saying anything bad about those guys, but in general, what they're doing is they are bringing you claims data after the fact, and they sort of have a network of providers that they can kind of generate referrals over the fence to. And then those providers sort of do what they do with the members and then submit a claim. And so the data that they have is very limited. At Spring Health, what we do is we're kind of like a managed care organization and a national high quality center of excellence had a baby. We're a different thing. We have all of the data on what's happening with members, whether they're getting better or not, and what their claims experience is instantaneously. That's the way that our platform and our model works. 100% of our members, providers, and our HR teams are all using one unified platform for 100% of the interactions that we have with our members globally. What that means is I can take the data from your health plan and I can look at Spring Health members and non-Spring Health members, and I can look at the total cost of care of those two individuals, people who use Spring and people who do not use Spring. And in a very dollars and cents way, show you that the people who utilize Spring have a lower total cost of care than members who don't. So that's one way that we measure ROI. It's one way that CFOs and senior people who make finance decisions really, really appreciate. But we also look at things like productivity and do these members stay at work or not over time. We know if members are utilizing Spring Health, we know if they're still at your company, and we can show that the members who utilize Spring Health versus the members that don't utilize Spring Health, those ones who utilize Spring Health are much more likely to still be at your company and to not turn over time. So we use that to show return on investment from a employee retention perspective. There's a couple other ways that we measure this with real data. I won't go into them because I'm already talking too much about this, but would love to have that conversation one-on-one with you or your organization at any time. I think we have one more question, and I'm going to point it at Kelsey. Sorry, Kelsey. Here it's from Maggie, and it said, "Can you talk a little bit more about plans or support for employees prior to needing to request mental health leave and what that can look like?"
Yeah. I will just caveat this 30 days in, I'm diving into this problem for the first time. But I'll tell you what we're thinking about right now. What we are doing at Spring is like really analyzing the data we have on mental health leaves and any information we have on why they're happening, where they're happening, what the organizational context is within that part of the org, whether it's like reorgs or we have engagement surveys, right? Like what kind of data can we triangulate to help us understand what's happening? And then how can we provide preventative support, right? So an example of something that is happening in one area of our organization is like there's the spike in mental health leaves, and we know that the managers on that team are quite junior and not comfortable having these conversations with their employees. They're oftentimes directing to HR, they're oftentimes directing to Spring Health, our product, which is great. It's not the wrong answer. But if we can build the strength for those managers to maybe be able to root out how it's going, what's going on, where's the burnout coming from, and reduce the risk of overload and feeling like somebody cannot be successful in their role faster before somebody gets to a point that truly is like, I need to take leave and I need to take leave now. That's what we're trying to do here. And so it's an analysis and assessment of what we know internally. we also, of course, at Spring Health, right, our employees know all about the Spring Health product and what we offer, but making sure that people have the time and space to utilize it, right? Like something that I love about Spring is that even if our C-suite, for example, even if their calendars are private, the public meetings on their calendars are their therapy sessions, right? Like, so making sure that people know that this is okay, this is acceptable, you can use this. If you don't know how to access care, here's how you can access care. And so really partnering with our own product and understanding what the data is telling us. I think we are like right at time, so I can't go deeper now, but that's a preview for you, Hattie.
All right. Well, the participation from the audience was just exceptional in this. So I want to thank the audience for joining and especially thank my co-panelists here, Kelly, Kelsey. Thank you so much. Hopefully these insights were helpful to the audience, and I hope everybody has a great holiday season.
Great. Thank you, everyone.
Thank you.
Thanks, everybody.